healthcare consumer and I am a healthcare provider. I'm really honored to spend a few moments with you sharing some things that I learned in Washington, D.C. about we Hoosiers and healthcare reform needs. And these come out of the Bureau of Labor Statistics and from both that division as well as from the public policy components of AARP. We are almost 900,000 Hoosier members strong. We are 40 million members strong in the U.S. and wherever people live that are AARP members. They are working hard on my and your behalf and our friends and relatives and neighbors and fellow Hoosiers to bring about healthcare reform change. In Indiana, and I'm going to set this one step down. Put on the magnifier. In 2008, there were 958,270 Medicare beneficiaries. So Medicare reform is very important to Indiana. Between 2004, it was determined that 84% of those of us who are 64 or older were recipients or included in that number I just quoted you. Yet, we pay 30% of income toward our health care costs. That means there are about 107,000 Hoosiers who are paying more than 30% for their costs to have health care coverage and to be cared for. We also know that for those of you who've ever been in hospital, some 3 out of 10 older adults within 30 days are readmitted because something has not happened in the plan of care, whether that's related to knowledge, misunderstanding, care providers, transportation, medication, plans. So that's quite a drain on the system, let alone the emotional trauma that the person experiences. And in Indiana, we know that, like every place in the world, 100% of the people want to live at home and to receive health care services in their home. But our state continues to pay 95% of its Medicaid dollars for institutional care. So those are some of the issues that Hoosiers, legislators, and we are dealing with. You're going to see in the film that this is a film talking about America and its health care deficiencies. We know that we have an excellent medical knowledge, we have superb technology, but we also know there are people in this room and people that we can name who their services and their needs have not been met by our current broken system. And it takes each and every one of us to read, listen, learn, watch, and make your own careful, prayerful, legal, and personal decisions on how we enact healthcare reform. So with further ado, the movie is long. The movie focuses on various issues, some of which were touched upon in my statistics. Thank you, and we'll talk soon.
Now, there is over here a table of refreshments. What is your wish? Do you want to wait till after the movie and then have a social time and share the goodies on the table? Or do any of you that feel that you need some refreshments now, you're free to do so. But what's the general feeling? Would you want to? Okay. I'm getting some statements that they'd rather wait, see the movie, and then have a social time following that.
And I would like to thank our kind host and hostesses, Sanctuary St. Paul, for both the accommodation, the presence, and the kind spread that they have provided. And if anybody needs fluids or some sort of sustenance, please just excuse yourself and get what you need. We don't want to keep anybody who might have the medication that they have adopted and adapted within their countries. And they focus on Great Britain, Germany, Switzerland, which probably is the closest of those democracies, because they have had, and many of the drugs that you purchase come from the Swiss pharmaceutical companies, as well as they have an insurance system very similar to our type of insurance and healthcare coverage. So again, it's Taiwan, Great Britain, Switzerland, Germany, and Japan that are investigated, and they look at all the issues, their strengths, and how they are paid, what they provide, and how that impacts the people. You have seen Michael Moore's, and obviously it was done in 2005, 2006, 2004, and there have been some changes. He starts out talking about how healthcare needs have impacted the poor, and now it has impacted the middle classes, small businesses, large corporations. We are untouched in all walks of life. And we also have seen various other changes. He talks about being 37th, and that analysis comes from the World Health Organization, done in 2000, and that's based on quality of care, outcomes, treatment, as well as fairness across the spectrum. I also wanted to indicate that in Indiana, our cost of drugs, despite the fact that we are the home of Lilly and Pfizer, our Hoosiers pay more than other older adults across the U.S. for the average is $53 for a prescription. In other states, for 10 drugs, and most Hoosiers are on 13 drugs at $49. So cost and volume and looking at outcomes. Those are just some of the points I had, but we want you to take the opportunity to ask questions. We will review if you want to take and get something to eat or drink, and then begin the dialogue. We open, how would you like us to handle it?
Why don't we take a break to refresh ourselves, and those who want to have any discussion,